Good morning, everyone. Thank you all for allowing my team and I to present our poster to the conference today, where our goal is to allow you all as healthcare professionals to become more knowledgeable and be able to hopefully strengthen your organization's reputation involving operation capabilities with some research-based methods. We feel our poster is highly relevant to this conference's theme, and with that, we will be covering a variety of topics. The creators of this poster include me, Bethany Voigt, Catherine Kavanagh, and Joanne Mejia. On behalf of the team, I will be presenting the poster to you all today. I will be going over vocabulary servers and services, databases, enterprise terminology systems, and metadata registries. Vocabulary servers allow organization of multiple standard terminologies, and they provide the ability to house local extensions as well as multiple standard terminologies in one location. They were developed by private and public sector groups that develop, maintain, and distribute the vocabulary servers. Multiple entities such as hospital systems, software vendors and developers, electronic health records, informatics, and clinical use vocabulary servers need to follow basic conventions and be robust, functional, organized, and of course usable. Revisions can occur on a calendar basis or whenever a standard terminology updates occur, and they are released on an ad hoc basis. Updates can be automated, processed, and there can be manual updates as well on the software or the content. Moving on to common terminology services. There are two CTSs currently, CTS 1.2, which was developed by HL7, and CTS 2, which is a standard that was developed in collaboration with HL7 and Object Management Group, also known as OMG. OMG produces and maintains specifications for portable, interoperable, and reusable enterprise applications. CTS is a standardized interface for the use and management of multiple terminologies. The goal is to enhance semantic interoperability of healthcare data. To do so, it designates the functions that a terminology must meet without necessitating a common data structure, and provides end users with principal functions of a vocabulary. It also provides specifications for sending and receiving terminology to terminology implementers. Guidelines given by HL7 CTS define HL7 message runtime, which in itself defines functions of applications, vocabulary runtime that define capabilities needed, message browsing, which provides details in vocabulary, vocabulary browsing, which is used in authoring content, and lastly, code mapping, which is one-directional mapping of concepts. Now I will move on to databases, and specifically for this topic, we will be discussing Unified Medical Language System, or UMLS. What is UMLS? Well, it is a set of files and software that brings together many health and biomedical vocabularies and standards to allow interoperability between computer systems. UMLS can be used to link terms and codes between your doctor, your pharmacy, and even your insurance company. It can coordinate patient care among several departments within a hospital, process text to extract concepts, relationships, or knowledge, make it easier to map between terminologies, extract specific terminologies from a metathesaurus, and for the creation and research of patient data. UMLS has multiple identifiers for its content. First is Concept Unique Identifier, or CUI. Each concept has a permanent CUI. It is also meaningless and never changes but once there are two CUIs for the same concept. The CUI is then removed from the metathesaurus. Then there is Lexical Unique Identifier, or LUI. It links lexical variants. It also begins with the letter L and is followed by 7 numbers. There is also String Unique Identifier, or SUI. If there is a variation in this case, punctuation or character, an SUI is assigned. It starts with an S and is followed by 7 numbers. Now I will discuss some enterprise terminology systems. The first one is referred to as the National Cancer Institute Enterprise Vocabulary Services, or NCI-EVS. The second is referred to as Public Health Information Network Vocabulary Access and Distribution System, or FINVADS. I know, these sound like some scary big phrases, but they are simply easy to understand. NCI-EVS basically organizes terminology tools, content, and services. It is used to code and leverage biomedical research as well as clinical and public health data. This type of system was developed by the National Cancer Institute. The main purpose allows cancer researchers to have quality access to terminology content with data exchange and interoperability. In terms of the content, it is made up of an NCI thesaurus and an NCI metathesaurus. The NCI thesaurus connects persons and software applications. It is also ensured to be maintained regularly and allows researchers to become familiar with textual and ontologic biomedical concepts. The NCI metathesaurus involves biomedical vocabularies and concepts, and it also contains non-proprietary contents of UMLS. Moving on to the Public Health Information Network, also known as FINVADS. This type of system was initiated to access, search for, and distribute value sets. It was developed by the Centers for Disease Control and Prevention, also known as CDC. This system has a purpose of maintaining standardized vocabulary and supporting the exchange of health information. It also seeks to organize value sets relative to HL7. In terms of this system's content, it contains 35 code systems, 1,200 value sets, and over 2 million concepts. With this, it ensures there is quick access through any metadata for HL7. And some common uses of this content include reportable condition mapping table, public health meaningful use vocabulary, healthcare-associated infections, and flu lab report vocabulary, which all have their specified domains for cancer research. Lastly, I will discuss metadata registries. The first is Value Set Authority Center, or VSAC. This was created as a collaboration between the National Library of Medicine, the Office of the National Coordinator, and the Centers of Medicare and Medicaid Services as a single source of value sets. Value sets on VSAC contain lists and codes required by the CQM reporting and identify patients that should be included or excluded. This also consists of one or more codes to define clinical concepts. VSAC organizes the content by tabs. The first tab is Welcome, which provides a brief overview and hyperlinks. The next tab is Search Value Sets, which allows the user to search with ease and download search criteria in Excel or XML files. Another tab is Download. This lets the user sort by publication data and CMS ID. The last tab is Help, which has a hyperlink to the National Library of Medicine customer support, instructions on how to use, and tips on how to filter and search. Lastly, measure contractors are responsible for creating and maintaining this every 3 years. Now for the U.S. Health Information Knowledge Base, or USHIK. This supports the initiatives to promote improved health research by creating and maintaining metadata registries. It contains data elements adopted by HHS and is divided into different portals which can be accessed through tabs, which are USHIK, Standards, Health Information Standards Panel, common formats, meaningful use measures metadata, or MUM, all payer claims databases, or APCD, and standards and interoperability framework. There is a tool that aids in assisting the user to compare data elements across multiple standards and portals. Each of these portals comes from a registered authority, and the author is the owner and is responsible for updating information within their portal. This concludes our poster presentation, and our references can be found at the bottom right corner. We hope that you all will be able to utilize the information learned today throughout your healthcare organization, and we wish you all the best in your terminology tool endeavors.